Hi, everybody. Welcome back to the show. Like I usually say, I'm your host, Dr. Ron, and today I have with me Anne in the studio. She's an information analyst. And for those of you who have been asking me repeatedly, what do information analysts do? How can we get into that space? So I guess today is your lucky day. Welcome, Anne, to the studio, and thank you for giving us some of your time today. How are you doing?
I'm very fine, Dr. Ron. Thank you so much for having me. I'm happy to be here. So thanks for inviting me.
Yeah, so you work as information analyst. So I just
Senior
want us to,
senior
okay,
information
senior,
and
I'm really sorry, senior information
no, it's
analyst.
fine. It's
Right.
okay.
So I just want us to unpack that, journey, what it is you do, what skills you require to get into that space. And typically, I usually like starting from the beginning. So how did you get into this place, into information analysis in the first place?
Okay, so my journey is a very interesting one. I have been told a lot that it's not a very common transition. So I'm always very happy to share my journey.
Uh-huh.
So I studied accounting as my
Interesting.
bachelor's degree, and my initial background was financial services. I had worked in a bank. I've basically worked in like three or four different banks, mortgage banks and commercial banks. And after I studied accounting, I went ahead to start my career as a banker. And I worked in the banking for maybe like 13 years.
Wow.
And yeah, maybe like 13 years, yeah, that long. And that was pretty much everything that I knew from accounting to financial services. I had worked in different roles as a banker. I had taken up roles like customer service lead, operations manager, head financial transaction, taking up different roles as a banker. And then at some point in my banking career, I felt like I wanted to do something different. You know, where you get to a point where you know that you want to change, like a
Yeah.
major change. Yeah, so I got to that point where I wanted like a major change in my career, and COVID came, and I felt it was a very good opportunity for me to learn a new skill or learn
Okay.
something else that would help me to easily transition. And during the COVID-19 lockdown, I decided to learn data analytics. Now, why data? I felt like I had some skills already because my accounting background made me very good, like with quantitative data. And
Okay.
then I had some other skills like problem solving and some analytical skills because of my career.
Uh-huh.
And I felt like it would be easy for me to transfer those to my career as a data analyst. So I started off like with a self-study, and I think it was a course I did on Coursera. Did an IBM professional data science certificate program on Coursera. It was supposed to last for like 6 months, but I think I did it shorter because I was paying, I think maybe like $45 every month, and it was self-paced. You could finish at any
Yeah.
time. So I wanted to finish it quickly. So I just rushed it somehow. And because of COVID, I had a lot of time on my hands. So I finished that certificate program, and it was very interesting. By the time I finished that course, I knew that I wanted more. I then knew that, yes, I was ready to be a data analyst or a data scientist. I was just interested in data. Then after that, I did a program. I enrolled in a program, like a 6 months program with a
Okay.
company here in the UK where I got trained as a business intelligence analyst. It was
Interesting.
a very intensive program. We had to do projects at the end of it as well. So I did that program. It was supposed to last for 6 months, but it ran into a year because I had a baby. When I started the program, I was pregnant. So I had a baby in between. And then after I gave birth, I had to take some time off the program. And then I came back to continue. And then I rounded up the program. And I think the following year, I then did a training for project management as well. And I got a project management certification, a PMP certification the year after that. And then I was doing data analytics on the side, just, building my skills, taking up challenges here and there,
Okay.
doing things like on Fiverr, Upwork, while I was still working full time as a banker. And then I think after like 2 years, I had done that for like 2 years. And I now decided that I was going to pursue a full time career in data analytics. And then I came to the UK to do my master's 2022. Yeah, that's like 2 years after the COVID-19 lockdown. And then I came to do my master's. I started my master's like in September. I still wasn't so sure what path I wanted to follow. Like in the data analyst path before, didn't know if I wanted to be in healthcare, if I wanted to be a finance data analyst. I wasn't so sure. I just wanted to like have my master's in data analytics. And then I started in September, and then I did like my first semester. And then by January, by my second semester, I chose now. I'm going to talk about how I decided on healthcare. That's the point
Okay.
where I am right now. So by January, I chose a project supervisor, and I had chosen the topic that I wanted to write on, and it was supposed to be in finance.
Okay.
So my project supervisor and I, we started having meetings and everything. And then I went to the hospital one day and I visited A&E, and I was in A&E for like maybe over 10 hours. I went there maybe like 4 in the evening, yeah, maybe like 4 or 3 in the afternoon. And I was there till like almost 1 a.m. And at that point, I just made a decision that I was going to write my project in patient wait time because I didn't understand why I had to stay
Nobody
that
had to
long.
wait an
Yeah,
hour.
exactly. I didn't understand how I had to wait that long in the hospital. So I decided that I was going to write my project on patient wait time. Then I emailed my supervisor and told her I wanted to change my project topic. And then I chose a topic, the use of predictive analytics in assisting the reduction of patient wait time. It was a study on respiratory illnesses. So from that point, I knew that I wanted to work in healthcare. So I then started applying for jobs. Now, when I came to the UK to do my master's, I wasn't 100% sure of what was going to happen after my master's, to be honest, because I had my family back home.
Yeah.
I had just left my options open. Like
Yeah.
whatever happens, I'll be fine with it. Even if I have to go back home, I'll be okay. Right. Then I just started applying for jobs and just said, okay, let me just explore options here in the UK and see what happens. I started applying for jobs and my main focus was the NHS. I really wanted to work in the NHS. And I started applying for job roles. I did a few interviews. And then by March, in my second semester, I got my first job in the NHS, and it was with Digital Health and Care Wales.
Okay.
And yeah, so because I was still studying, I didn't really start working till like in June after I had done like all my lectures.
Okay.
And I started working, even though I was still working on my final project. Then I started working, and then I worked with Digital Health and Care Wales for a year before I then got my role as a senior information analyst with Midsheshe, where I'm currently working. My journey into healthcare has been so interesting, unexpectedly exciting. And to be honest, I feel like this is home for me. I don't plan on leaving healthcare anytime soon. I'm so far enjoying my role as an analyst in healthcare where I'm making an impact and so far okay with it.
So
So that's the
banking has
story.
lost one person to healthcare now, right?
Well, you can say that.
That's a win for us. So I'm going to take you back a bit, right? So you mentioned you took some courses, the self-paced courses, which you now sort of, in addition to that, you did the, what I call it, internship or something on top
Mhm.
of that. So how effective would you say they were?
Yeah, those programs were very effective because even if I decided that I wasn't going to have like a proper degree, I would have still been okay
Okay.
because the course that I did on Coursera, even though when I started it, I felt like, oh, it wasn't that serious. It ended up to be something really serious. There was a final project after that where I think I did analysis on restaurants in Canada or something. So I did, and there was a proper course. I learned, that was where I first had learned how to use Python
Okay.
and SQL. Yeah. So it was a very good course. And then the program that I did was really intense. Like apart from the training, we now went ahead to work on projects. I think maybe like 3 different projects where I got my hands like on real data sets and did things like that. So it
Yeah.
helped build my experience. So even I got my job. Remember I mentioned that I got my job while I was still studying. So I didn't
Yeah.
even need to have my degree for me to get a job. But because I had gained those skills, and even in my interview, I was able to show what I had done based on those programs, those courses and the internship and everything. I was able to get a job even without having a degree. So
Uh-huh.
those courses were really very important towards my transition. Yeah.
So you mentioned SQL, you mentioned Python, which I know are some of the tools you use in your like day-to-day activities.
Well,
So how difficult is it to learn Python? I'm just asking for a
Um,
beginner who's probably watching and thinking, okay, I want to get into this space. How difficult is it to learn Python? How much effort did you
Python.
put into it?
I am a strong believer of Python.
Okay.
To be honest, I am a strong believer of. I love Python so much, and left to me, they should just. Well, I'm not supposed to say this, but left to me, people should just stop using Excel. No, I'm saying, no, don't get me wrong. What I mean is, Python is so good that it can do things like within minutes, and it's not very difficult to learn. I don't know why. I've seen a lot of people when they're talking about, like, they're telling people to start careers in data analytics, or they're advising people, they always say, oh, you don't have to code, you don't have to program. And I'm wondering why, because it's actually very interesting to use these programming languages to run
Mm-hmm.
your data. Do you understand? Like, it's not very difficult. It's just like, think about it like learning every other language. It's never easy
Yes.
when you're learning a new language. If you're learning French today, it's not easy. If you're learning Spanish, it's not easy. But with time, if you keep speaking it, you would learn it and you get really fluent. That's the same way programming languages work. When I started with Python, it was with the IBM data science professional certificate course I just told you about.
Yeah.
And when I just dived in, that was where I started from. Imagine starting from that. That was where I started from. I just dived into Python, and it was, at first I was like, am I sure I know what I'm doing? Do you get? But the more I practiced, the better, the more I understood how the whole syntax runs
Work.
and how it works exactly. So, and the more I understood it, the easier it became for me. So even in my master's, we did Python as well.
Okay.
Cricket. So they taught us how to do other things like running big data in
Yeah.
Python environments. Yeah. So Python is actually not that difficult. You just need to start from somewhere.
Okay, that's interesting because myself, I tried Python a bit and I ran away when I discovered data wasn't my thing. I did this. I think there was this. Is it Google Data Analytics course or something?
Mm-hmm, mm-hmm,
Yeah, so that was also very good because it sort of laid a good foundation, Excel manipulation. And I think towards the end, they started introducing Python, IDE environment, and all of those things.
mm-hmm,
I'm like, you people are beginning to stress me too much. Oh. Now run away, you know. So, but again, like you said, it's practice that makes perfect because,
mm-hmm.
I mean, as I kept on using it, I got better, but data wasn't my thing. I just, left it like that and moved on. So apart from Python, SQL, what other tool sets do you use on a normal day, or do you think
Uh,
an information analyst needs to know?
well, the main ones are SQL, Excel, Power BI, Python. Those are like the basic tools that you need in most organizations, especially like in the NHS, for example. So for a healthcare analyst, except you want to use some other stuff like Google Cloud Platform and all of those, but we don't use that a lot. Like at least in my two roles that I've had, I've not used. Okay, although in digital health and care wells, we use Google Cloud Platform a little bit, but that was just like on training. But once you have Excel, SQL, Python, and Power BI,
Yeah.
you'll be fine.
Okay. So those are the basics, and that
Mm-hmm.
should be able to get me going
Mm-hmm.
comfortably.
Yeah.
Okay, that's good. So those watching, if you're thinking of this area, these are the two sets you need to sort of get familiar with. So let's look at what you actually do day to day. People might be watching what does an information analyst actually do in the hospital? So what's your day to day like? What do you do?
Okay, so my role is basically I work with community services. I am the analyst that handles community services within my trust.
Okay.
And community service, we have a long list of different services. There's physiotherapy, podiatry, speech and language therapy, all of those. Now, all of the services, I support all of the services with anything that has to do with data. I
Okay.
help them with their performance measurements, measuring their different metrics, making sure, and then I also help them like with capacity and demand modeling to
Modeling.
show, yeah, modeling exactly, making sure that they have the required resources to be able to give patients the treatment that they require. So my job is very interesting because, like I said, supporting community services, just making that now we're at a point where the NHS is going gradually from hospital-based treatment. They're driving towards
Community.
exactly community services. Exactly. So my job role is basically making sure that the community have the resources that they need, making sure that they are able to track their activity, know exactly how many patients they are treating, what referrals are we having patients not attending appointments and things like that. So that's just basically my job, to ensure that the patients have the support that they need when it comes to data or performance measurements.
Okay, that's interesting. So is every day the same, or is every day a different problem or challenge?
There's never 2 days. There's never 2 days that are the same, because you know that um as a data analyst, your work is not just tied within your task, your daily task. Your work is
Yeah.
also tied to clinicians, the clinical leads, the service leads, the operational managers, right?
Yeah.
So, and they always have, because of some of them, some of these community services, the way their services run is different. Each community service is very different in how they run their clinical process. So there's no way you will have 2 days that are the same, because they would always come to you with one support or the other, something that they need, or they want to know exactly, oh, this is what happened. Sometimes they might even want to know what happened 5 years ago. They might want to know what happened 2 years ago. It's
Okay.
your duty for you to be able to support them. Anytime they need that support, you should be able to handle their requests. So I can't say there's definitely no 2 day that is the same. So yeah, that's basically it.
So now what you've painted looks like very interesting, right? But I know there'll probably be challenges behind all of this. So what are your biggest challenges in your day-to-day job? Because I think people need to know too that it's not all green, green, green.
Well, I think that every data analyst, regardless of where you work, I
Yeah.
don't think there's any data analyst that doesn't deal with data quality issues.
Okay.
And I think that's like one of my major challenges, like having to deal with data, because of course you want to be sure that your reports are reflecting the are a true representation of what it is, what it's really supposed to be, right? So data quality is one thing that impacts my job. My previous role, my present role, it's always a challenge, because of course, when you have data quality issues, you need to start finding out, okay, where did this come from? Is it from the data source? Do I have to go back to the data source? Sometimes you spend several hours trying to do some transformation on the
Yeah.
data, yeah, that you have, to correct some of those data quality issues. Sometimes it requires some back and forth movement. You have to go back to the source where the data come from, where the data came from, to ask, okay, I have discovered this data quality issue. Am I supposed to correct it myself? Do you need to resend the data? So all those things, it actually slows down my work sometimes. So I would say that that's one challenge. That's one major challenge. And then apart from that, when you're working in healthcare, the sensitivity of the data you work with, of course, confidentiality issue, you have to be careful when you're working with patient data. So that's one challenge. You have to be aware of what the policies are. What does the GDPR policy say? What does the data protection policy say? Of course, you also have to know all the principles, the Caldecott principles, everything. You need to know them, because you're dealing with confidentiality issues, patient data. So that's one thing that you have to be conscious of. So I would say those are like the two major challenges when you're working as an analyst in healthcare.
Hmm. Interesting. So you talked about issues around, confidentiality, being aware of GDPR, DPA. Think is it the code?
Yes.
Exactly. So looking at what you do now, are there situations where maybe you've had data breaches or issues, and how did you manage that?
I've never, I've,
You've never had
to be
or
honest, I've never experienced data breaches, because I'm very conscious of it.
okay.
If I have to, if my data requires me anonymizing or pseudonymizing, I have to
Yeah.
do that. I have never had any issue with data breaching, because, of course, my financial background already has
Gotcha.
prepared me. My financial background has prepared me for this kind of data issues, like confidentiality issues, because I can't tell you how many trainings I did on information security when I worked at the
Great.
bank, because we were always made aware of our responsibilities when we're handling customer data. So I just need to apply all those things, even when I'm working with patient data, to be sure that I'm not breaching any confidentiality issue when I'm working with patient data. So I make sure that I don't, even if it requires me carrying along the information governance specialist that know more
Yeah.
than I do in that area, I will do that if I need to ensure that I'm not even breaching any issue with
Any issues?
confidentiality. Yeah.
Yeah. Okay, that's interesting too. This leads me nicely into the next question. You mentioned information governance, and now we're talking about AI. Everybody is singing the AI chorus now. How does that play in your role? Is this something as analysts you guys are embracing or beginning to use? How is that happening?
Well, generally in healthcare, many healthcare organizations are relying a lot on AI. There's an article when I was doing my project, my final project. I mentioned that I wrote my project on the use of predictive analytics here. When I was doing my project, I did some research and I came across an article by the Health Informatics Service where they talked about the use of predictive analytics and how it was used like during COVID-19 to predict bed space and all of that. So a lot of healthcare organizations are gradually driving into using predictive analytics to predict capacity, to predict bed space, all those kind of things, forecasting and stuff. So in my current job role, I would say I don't use too much of AI because
Okay.
it's not required at this
Okay.
point. Yes, but I know that generally in healthcare, there's a drive to the use of AI in assisting processes and automating processes. Yeah.
Yeah. Because I was asking because, there's this misconception or, fear that AI is going to replace a lot of roles very, very soon in the future. So I was beginning to wonder if information analyst is part of the roles that are at risk.
AI is not going to replace information analyst job. And the reason is information analysts only need to learn how to implement these AI tools and work with them for them not to be replaced. So even if even if AI is they're using it a lot more, I don't
And
really see it being the work of a data analyst in healthcare being replaced by AI. You only need to be. That's why I always preach upskilling, knowing what is trending, and making sure that you're meeting up to standard. Because I
yeah,
mean, you don't want to be left behind. If not, like
absolutely.
the whole technological move is a move like a moving train. You have to jump on it, otherwise you'll be left behind. So you have to keep upskilling to make sure that okay, even if they say they want to bring some solutions, you're able to make a contribution because you have certain skills.
Yeah.
So yeah,
So talking about upskilling now, because I know one thing upskilling does for you is to sort of prepare you for the next role or more opportunities. So looking at the career trajectory of somebody who is in data analysis space or information analysis, what are those? How high can I get in terms of career progression?
you can get as high as you want. You can get as high as you want. You can get. Let me just explain to you. For example, now
Yep.
I am a data analyst, right?
Yep.
But I can be a business intelligence analyst. I
Okay.
can be a data scientist. Why?
Okay.
Because I have all of the skills.
Uh-huh.
So it depends on what exactly that you want. What are your goals?
Yeah.
Knowing your goals, you should get the required skill. You can go as high as you want. If, for example, I decide today because of the skills I have been trained not just as a business intelligence analyst. I have also been trained as a data scientist. I can do predictive analytics. I can do statistical analysis and things like that. If today I decide that I don't want to be a business intelligence analyst. I want to do more of the data science. I want to be building machine learning models and things like
Yeah.
that. I can because I have the skill. So I don't think there's any limits to how far you can go. It just depends on what your goals are. You need to know exactly what are your goals. What exactly do you want to achieve? And based on that, you have to equip yourself with the right tools, equip yourself with the right knowledge, the right resources for you to get to where you want to get. But can't really say, oh, there's a limit to that. I mean, technology is like I said, it's a moving train. Every
Yep.
day there is a new trend. Every day something new is coming up. We went from AI, we're now talking about generative AI. We're now talking about there's a lot coming up. So you just need to keep upskilling, keeping up with the trends you get. So I don't think there's how far you can get. You just need to know exactly where you want to go.
Uh-huh.
to get there.
So I'll take you back a bit now. So you did a master's, right? So how important was that master's to your current role now? Because there's this, what would they call it now? People are usually torn between, should I do a master's, paying that whole amount of money to do an MSc in the UK, or should we just take some courses, get some hands-on experience, and just move on? Is it worth it to do a master's?
Looking back now, I'm very happy that I did my master's. And the reason I've seen a lot, I've written about this on LinkedIn,
Okay.
right? Where I talked about this exact thing that you're asking me now, right? So basically, what my master's did, the difference between me having a master's and not is that my master's built my confidence a lot more than
Okay.
when I just did like the regular courses. Because of course, when you do your master's, you would learn, you would do presentation, you will learn other things. Now, apart from building my confidence, another thing that my master's did for me was that it made me even understand the difference between just being a data scientist, being a business intelligence, and I was able to understand matching your data skills with performance, being able to know that there's the goal, the organization you're working with has a goal, right?
Mm-hmm.
They have a strategy and you have your data skills. How do you link those your data skills to the business strategy? How do you link your data skills to the goal of your organization? My master's opened my eyes to knowing that you can't just be working, okay, your job shouldn't just be analyze data, produce results. How does that translate to the overall goal of the organization that you work with? Do you
Yeah.
understand? Are you adding value? What exactly are you adding any value? Because I mean, you just don't want to be doing your job without adding value. Does your work add value? Are you what's it called, working in line with the goals of your organization? So some of those things are the things I learned when I did my masters. So looking back now, I'm glad that I did my masters because, like I said, and then there's some other things that I learned before. I didn't have good skills in statistics. Now, I used to run away from. Let me tell you a funny story. I used to run away from maths and statistics. In fact, when I did my bachelor's, I didn't really like, I did a course in EcoStats and I did a little bit of statistics, but I never liked statistics at all. I'm not going to lie. But now, when I did my master's, statistics became one of my favorite models because when I started my master's, I was scared at first, like, see statistics. When I saw all the course contents, everything, I was like, wow, I'm going to fail. But, it pushed me to want to learn more because, I mean, you know how much you've paid in your school fees. You don't want to
Yeah.
disappoint yourself. You don't want to disappoint those that are looking up to you. Do you understand? So it pushed me to learn. I was putting in hours in learning my statistics. And I can say today, I don't even know how to manage, but I've now become so good in statistics that even when I go for interviews and they're telling me, oh, you did very well, you have very strong skills in statistics, I'm like, me? I didn't realize that I could be good in statistics. So that's what I would say. That's what I would say my master's did for me. Like it pushed me to do more. Do you understand? Like I was pushed to do better.
Yeah, I also agree with you, because this like probably recurring argument in my circles, some people are like, just get a certificate, do some courses, and you're good to go. But I'm always like, I think a master's is actually helpful, even though it's expensive, but it gives you that additional skill set. It owns your mind and brain to other things you should be doing rather than just focusing on your day-to-day job
Exactly.
description and all of that.
Exactly.
So you moved from the finance space into the NHS. How difficult was that transition?
It wasn't, I can't say it was a smooth transition
Okay.
because I mean, people like you, for example, that
Let's get background.
have healthcare background, I feel like it would be smoother for you to just dive in. But for me, it wasn't very easy because I mean, all I knew was financial data, banking, cash, customer
Yeah.
service, and all of that. That was all I knew before coming into healthcare. So imagine, like in my first role, starting work, like the first 1 month, 1 or 2 months, I was asking myself, "Am I sure I'm in
You're
the
in the
right
right.
place?" Do you understand? Because I mean, you just start work and everybody just expects you to just know what's happening around. Someone is telling you, oh, that's lymphedema data, that's heart failure data. And I'm like, what are they talking about? What's lymphedema? You get? So I'm like, what's lymphedema? I think what I did, that's why I always talk about having mentors, because that's what mentors are for. You get? So what I
Yeah.
started to do was to speak to people that had been in healthcare for a while or that had worked in the organization for a while, like telling them. And then it happened that I was putting myself under a lot of pressure. Like I was expecting to just know everything at once.
Yeah.
Do you understand? And it wasn't meant to, it wasn't supposed to happen that way. And then I started speaking to people and they told me, you know what, you need to just take it easy on yourself. You don't have to know everything at the beginning.
Yeah.
As time goes on, you would understand a lot more. And that's how I started like to take it one step at a time. And one thing that I did, I do a lot of self-study. So I started to read a lot about clinical pathways, knowing exactly, okay, because there are some things that you need to know, even if you're not from the healthcare background, you're not from a healthcare background. When
Yeah.
you're working with data in healthcare, you can't say, oh, I don't know what is lymphedema, or I don't know what's, you have to know what the clinical process is. You need to know, okay, someone that has lymphedema, what kind of treatments do they have? Somebody that has heart failure, what kind of treatment do they have? Now, in my role, in digital health and care waves, I was working with patient-reported outcome measures, and I was responsible for managing the data that had to do with prompts. And there were different pathways. There was lymphedema, there was heart failure, and things like that. And when I would look at the data for some pathways, I would say it's totally different from this other one, and I'll try to understand why. She understands. So I now needed to now take some time to understand why that data was different by understanding the health conditions, by understanding how the kind of treatment that the patients get when they come, and know the kind of questions that they get to be asked when they fill the questionnaires for the prompts. So I
Yeah.
needed to start learning all of that. So now I'm so good in understanding clinical pathways than I did when I first started, because the minute and then I started to build on my curiosity. I just don't see things and just ignore. I build on my curiosity. I want to know, okay, what exactly is podiatry? What exactly is speech and language therapy? What is stoma? I started building on my curiosity to learn more so that it will make my job easier. Like when I'm handling the data, I know
Yeah.
exactly what it's about and it's easier for me, smoother for me. So it wasn't a smooth journey. I had to put in a lot of work for me to be able to thrive in my job.
Yeah. Again, I mean, even for us who have healthcare backgrounds to it, in some cases, it might not be that easy, depending, because I was speaking with a doctor a couple of days ago and we're having this conversation. So irrespective of where you're coming from, I think there's usually one or two challenges here and there. But like you said, the most important thing is just being able to sort of ask why and building or leveraging on your curiosity to learn more, because some people just become laid back. Okay, it's not my business. But I think when you now start understanding the why, it probably
Mhm.
makes your job a bit easier.
Mhm.
Right. Then when you look at working in the finance space and working in the healthcare space, which one do you prefer now?
I definitely prefer my job in healthcare. Yeah,
Okay.
I prefer my job in healthcare because I'm not going to lie. Since I started working in healthcare, I actually look forward to coming to work because one thing, the time when I started my transition to healthcare was a
Uh-huh.
time in my career where I wasn't all about doing the job because of salary or because of making money. I was at a point where I wanted to make a real impact, where I wanted my work to add value to help to improve somebody's life. That was the point where I was when I decided to transition to healthcare. So my
Uh-huh.
job in healthcare, I am out there making a difference in a very positive way, making sure that I'm using my work to improve somebody's life out there. So it's something that gives me joy. And if you ask me what gives me joy in my job role, I would say yes, knowing that my work is helping to improve the life of patients or people out there that are using the service or the community
Yeah.
service. Yeah, that's what gives me joy. So it's not something, it's not a it's not a career that I'm going to leave anytime soon.
Okay. Then, so apart from this, like all the benefits, you're happy with what you do, you love coming to work. what are other perks that you sort of enjoy in this role? Because some people tell you, in my role, I work hybrid. I come to
Okay.
office 2 times, 3 times a week, or I have more time for my kids, or I can work weekends and stuff like
So
that. From your own perspective, what are the extra perks you sort of see
yeah,
from
of
this?
course. Of course, that one is I've been working from home for the past 2 years now.
Wow.
So yeah, I've been working from home, and in my previous role and in my current role, I've been working from home. And I can say that it has helped me a lot because I have gotten to experience work-life balance. I have
Okay.
kids, of course, I have a family, so it gives me time to be able to also attend to my family when I need to or do other things. And then apart from that, my work is also also have flexibility in my work. It's not just even that I'm working from home. I have flexibility. I can decide to do like compressed hours if I want to and
Okay.
work.
Awesome.
Yeah, I can decide to work like maybe I want to have an arrangement with my boss and say, okay, I want to complete my hours within 4 days so I can have one extra day to do something else for myself. I have that flexibility. I can decide if I have maybe challenges. I can decide to say, oh, I want to work like in the night. Can I move my hours to like late in the evening? I will, because someone like me, I'm actually thinking that I must actually considering it because my brain works better at night time.
Like,
Yes, it's very funny, but that's the truth. My brain seems to work better once it's 7 p.m. My brain is just like in full active mode. So it's
okay.
something that I've been considering. Like maybe I should ask my boss if I can work like from 7 till like midnight and then give myself and give myself like some time during the day to attend to my kids or do some other things. So I've been considering it, but I haven't spoken about it at all. But that's something that I enjoy in my job role. I mean, who would want to leave that? So
Yeah.
yeah.
I mean, everybody is talking about work-life balance these days, and it's interesting. This is one of those roles that actually gives you good work-life balance. So, yeah, probably no, it's not for me. Data is not my forte, so I'm not coming over to your side. Happy where I am. So, for anybody who is looking to get into this space now, what would you say are the steps? Like a newbie, I don't know what to do, and I want to get into this space. Can you just like in 1, 2, 3, 4, 5 steps say this is the pathway you need to, or these are the things you need to do?
Well, the first thing that I would say is to get the right skills, the right training, have the right training, the required build your skills. And then when you
Okay.
build your skills, one thing I would say is to get a mentor. I wish someone had told me this when I started, because when you have a mentor, you have better direction in what you're doing. I didn't have that, and there are a few mistakes I might have made when I started my journey. So I always encourage anybody to get a mentor. Get a mentor, build on your skills, network. That's how you get information. You have to build on your network. Networking has helped me so much, and I've seen the value of it. So I always encourage people to get to network as much as they want to. You get so get the required skills, build on your skills, take up additional tasks if you need to, just to make sure that you're building on your skills. Because
Okay.
the way data work is, the more you do, the better you get. So
Mm,
even when you're like starting, if you need to take up additional tasks for you to learn, I do that a lot, even in my current role. I just don't limit myself to my current task. I try to take more tasks that would help me build my skills, because every new task you take is an opportunity for you to learn something new. So I would say get your hands on more projects or more tasks that would help you to build confidence or build your skills, because
uh-huh.
training would help you, would lay a good foundation for you. But getting your hands on real world task or projects is what should build your confidence. So that's what I would say to anybody that's starting.
Is there any benefits to attending conferences?
Oh, how could I forget that? How could I forget that when I'm always attending conferences back to back? So yes, attending conferences is something that has helped me a lot. So
Okay.
yes, I would encourage anybody. I don't know how I missed that, but I would encourage anybody to attend conferences, because that's where I know exactly what's happening in the industry. That's where I meet people. That's where I
Okay.
connect with other people like me. I have a number of conferences that I've blocked out in my calendar that I have to attend this year.
Okay.
Even if I have to take my annual leave for those conferences, I do that.
And
Yes,
yeah,
yes, to attend, I do that. Yes, it's something that has helped me a lot. I've been every year I attend different conferences, and then I also do a lot of mentorship. Apart from attending conferences, I also help to mentor people that want to start a career in data. And it's so funny because even when I'm mentoring people, I'm also helping myself because I learn a lot from my mentees. There are so many young people out there that have fire. They know a lot. And even
mhm,
you as a mentor, you're learning from your mentees and you're also building your skills. So I do a lot of mentorship. I attend conferences, I network, things like that would help you, like starting your career or
yeah,
growing in your career. It will help you to grow in your career as a data analyst or information analyst working in healthcare.
that's interesting. Then another thing I'm also curious about is the impact of professional memberships, right? So because I know every sector or career paths, project managers, BAs, whatever, everybody seems to have an international body or association.
Mm.
So from your experience, how relevant is that? Do I really need to belong? Or, I mean, bearing in mind that some of this membership costs a lot of money. So if I was a beginner, would you say it's worth investing, joining those organizations?
Yeah, well, for me, I would say yes. I myself, I belong to a few of them, the British Computer Society and
Okay.
then the Association of Professional Healthcare Analysts, AFA. And I can say that they have been good. I attended last year, I attended the British Computer Society, the BCS Health and Care Conference,
Yeah.
where I met a lot of people in the healthcare industry and like top people, and I got to interact with them one on one, and it was really good. So I would say, and apart from that, they have platforms where you can learn. The BCS
Okay.
platform has so much
Resources.
resources where you can learn to build your skills. The same thing with AFA, and then there are some jobs that specifically ask for these memberships. I have,
I
yeah,
see.
yeah. I got into AFA after finding it in a job person specification.
Wow.
That was my initial, how I got into AFA. Like I saw it in the job where they said membership of AFA, that's the Association of Professional Health. And I was like, okay. And then I went to check what it takes to join it. And then I became a member. And being a member, it has actually added value because I get newsletters, I get to see job opportunities, I get to meet other people. They also have training that they do every now and then for
Okay.
healthcare analysts. So I would say those memberships are really important. Yes.
Oh, interesting. So if you're watching, just invest in those memberships anyway, even though some of them cost an arm and leg. I was looking at some a couple of days ago, and I think one was about £170. I'm like, this is a lot.
Don't think about it as an investment. I mean, I always see those things. I always see it as an investment
Yeah,
sometimes. So, and some of them come with some discounts.
yeah.
Yeah, so you don't always have to pay the full amount. You get
Probably keep an eye for some discount anyway.
like when I attended the BCS Health and Care Conference, I think the fee for the conference was a lot more than that, but I got to pay like half because I was a
Just
member.
remember,
Yes, so some of them come with some discount that you'll benefit from at the end of the day. Yeah,
yeah. Notes to myself. Probably should come pay that 170.
exactly. But what I would say about making those payments, those ones that come with those kind of payments, they are really good to be honest because they would have you should utilize the resources as much as like use the resources very well. Like the PCS, for example, they have this CBD where you can monitor your certifications, your training and everything you get.
Mm-hmm.
So you can use all those resources as much as you can to get value for the money that you pay for. That's what I would
Yeah,
say.
actually, I agree with you perfectly because I belong to, is it IIBA? Yes, the International Institute of Business Analysts. So, and that membership gives you access to a lot of templates that they
Mhm.
have, which is useful in my work. There are some things I want to do. I don't even want to stress myself. I know there's a template somewhere.
Mhm.
I just log in, get the one I need, and it makes my life easier, really.
Mhm.
So yes,
Mhm.
there's actually a lot, but sometimes the cost can be repetitive anyway. So That's me just saying my own anyway.
Like I said, I see it as an investment. I'm just invested, so it's okay.
Yeah. Then looking at what you do, if you were saying, what thing would you want to change about healthcare data? What will it be?
One thing I would like to change about healthcare data, I can't really say anything. The only thing that I would love to change is the issue with data quality. That's just where, like I
Yeah.
said, I have a challenge. If we can just get healthcare data to the point where we are dealing with very minimal cases of data quality, then I think most of us will be good, because when you have good quality data, you're able to run your analysis easily. You're able to monitor your performance. You're able to track your performance. Sorry. You're also able to manipulate your data whichever way you want to. You
Yeah.
would get more accurate results. Like when you run statistical analysis of this, it will make every other thing that you want to do become easier once you have good quality data. So if there was anything that I could change about healthcare data, it would be that.
Because I know recently there's been an increase in the use of RPAs or robotic processes to sort of input data into places and all of that.
Mm.
So would that help? Because I know from my own experience, a lot of the data quality issues usually stems from user errors,
Mhm.
manually keying in data, making mistakes and all of that.
Yeah, if we have more automated processes, of course, it will reduce some of those data quality issues, because, like you said, some of those they stem from somebody just filling in the wrong information, or someone not even filling it at all.
At all, yeah.
Exactly. So if we have something that can identify, or if something is missing, if there's a missing value, and it's able to detect and fill it in, or if something is not written correctly, if we're able to have that, that would, like I said, it will translate to having good quality data and address
Yeah.
the issue of data quality. So yeah, that's one thing that I'll change.
Okay. Are there any misconceptions people have about information analysts?
Um,
For example, for myself, so people say project management, is very easy now. It's not just to do this. And I just laugh anyway and move on because it's not the way people think. So looking at your role, do you think there are any misconceptions people think about data analyst and all of that?
well, the only misconception I would think is that sometimes some people feel like we don't have much challenges like working with healthcare data. Some people feel like working with healthcare data is just very straightforward.
Uh-huh.
I mean, working in healthcare and working with healthcare data comes with a lot of complexity. It's a very complex process. So I think that that's one misconception. Something that a lot of people just assume that, are you not just working? Is it not just working? You're working with patient data or that. So I think that's one misconception. But as a data analyst in healthcare, I can tell you that it's not what's it called? It's not an easy process dealing with your daily
Yeah.
task, because remember that you're working with people who don't have experience in data, and you don't have experience in clinical processes.
Yeah.
So that's what's it called now. You have to be sure that your work is adding value to their own work and their own job. Also, you're able to manage how it affects your own role. So those are some
Yeah.
things that you have to deal with when you're working as a data analyst, like in healthcare. So some of those things people don't really see it that way, but that's like a major challenge. I think every data analyst working in healthcare would tell you that they face challenge sometimes when you have to work with clinicians. You need to break down things to them. They need to understand how your own work runs. Do you understand? They need to understand.
Yeah.
And then you too, as a data analyst, you need to understand their own process. Because even me, when I do things like maybe capacity and demand, for example, I always have like engagements with the clinical leads. And the first thing that I ask them is, can you tell me more about your service, how it runs, what are your clinical processes? I always ask them those kind of questions so that I can know exactly what I'm doing when I'm working with their data. So we have those challenges, and it takes a bit of back and forth movement sometimes for you to be able to come to conclusion or a compromise within the job, within the work environment. So those are some of
Yeah.
the challenges that we face. For it's not very easy, I must say.
Yeah. So probably my last question is, so how important would you say information analysts are to healthcare?
Information analysts are so important in healthcare. Every healthcare organization, the main is focusing on making sure that you are providing good quality care to patients, right? I mean, you want to be sure that, and how do you know that your healthcare service is good enough? You have to make sure that you're measuring it's effective, right? It's
Uh-huh.
efficient, patient safety, your healthcare is person-centered. You have all those goals that you want to achieve. Every healthcare organization has. Now, when you have those goals, you want to know, how do you achieve effective care? How is your healthcare service person-centered? You want to know all of those. Now you need data, right? To measure your performance. You need data to know exactly what are you doing. Your activity, you need data to measure your activity. You even want to know exactly what are you doing, right? Now, if you have data, if you, for example, as a clinician, if you have data, it might not mean anything to you just looking at it as data. It is the work of a data analyst to put those data into meaning. Is the data analyst that will make you know exactly what your performance is when they have analyzed the data, when they have
Uh-huh.
when they have matched it with your performance, they will now go ahead to tell you this is exactly what you're doing. I mean, we have KPIs in the NHS that we manage that we want to know wait
Yeah.
time. We have different types of wait time, bed occupancy, all those things. How do you measure those things? Is when you have your data. The data analyst now breaks it down for you. So the job of a data analyst or information analyst is so important because they are like the key. They let you know exactly what you're doing,
What's going on?
what's going on. Do you understand? They are giving you insights. They are breaking everything down. They are simplifying it. We have the technical skills. Clinicians don't have the technical skills.
No
We
time.
have the technical skill. We have the technical skills. So we're using our technical skills and making sure that we're able to now interpret it and simplifying it for everybody, even the general public, for them to understand exactly what is going on in healthcare services. So the work of an information analyst is so important because we are the ones that would simplify things and create insights for people to understand more the data.
Thank you very much. I mean, it just while you were speaking, I was just thinking of my own role too. Every day I'm speaking with the BI guys. Somebody complains somewhere. I'm looking, can you get me the data for this? I need to see what data is saying. I can't just be taking complaints at probably face value. I need to see what data is talking about this. The constant back and forth. So yeah, you guys are very important and kudos to what you guys do. You mentioned you do some mentorship to people. So where can people find you? Because I know a lot of people might be watching, might probably want to reach out to you to speak about one or two things. So how can we find you?
I'm very on LinkedIn. You can find me on LinkedIn. My LinkedIn
Okay.
name is Nwaokolo. You can find me on LinkedIn. Yes, I think LinkedIn is the social media that I use the most. So I would respond if anybody sends me a DM because most times I go there like after work to see what's happening there. That's where I get most of my information. That's where I meet people. So
Okay.
yes, I'm very big on LinkedIn. So you can find me on LinkedIn. I'm not really big on other social media, but LinkedIn is my safe space.
Okay. If you're watching, you can find Anne on LinkedIn, send her a DM, but please don't send too much because she also has a work and family to take care of. So it's been interesting speaking with you. And any final words before we wrap up?
Yeah, I'll just say I'm inviting more people to join me.
You're recruiting
But
more information
yes,
analysts.
we need more, especially women. Women, I'm more particular about women. I'm sorry, but
Interesting.
yes, I'm very particular about women. We need more women in the tech space, in the health tech space. Yes, so I'm inviting my women to join me to become even it doesn't matter what your background is, whether
Yeah.
you're a nurse, whether you're a doctor, whether you've been an accountant, whatever it is you've done before, you can work as an information analyst like me. Yeah.
That's great. Your transition is an interesting one because you move from non-healthcare background into healthcare. Traditionally, I usually speak with people who sort of move within from clinical to non-clinical. But this is you moving from a whole different environment and you're thriving. So basically, yeah, we can also do it. So thank you very much for sharing your time with us. And if you're watching, I hope you guys have enjoyed this episode as much as we enjoy putting it together for you guys. Like I usually say, I'll see you guys in the next episode and bye for now.
Thank you. Bye.